IT spending at Denver Health it's a really big deal. IT is considered a strategic source at Denver Health. We've always been involved in driving the business and meeting business objectives. And controlling the spend has always been a huge issue for us. Well, you know, we've grown from about a $4 million IT budget in 1996 to well over a $30 million budget in 2010. We increased that budget at a rate of about 6% a year. And we knew that that can't continue forever. And so we always wanted to try to slow that growth or freeze that growth in some manner. And what we're missing is how to do that. You can't just go shopping for advanced systems and do price comparisons. From a spending standpoint, it's a multifaceted look at how you're spending your money both operationally and from a capital perspective that NPI looks at. From soup to nuts, it saves us basically over the contract term about 10% of the value of the contract by just having that kind of negotiation power and the understanding that NPI has seen 20 or 25 of these agreements and we've seen only one. I have no idea what the hospital around the corner just paid maybe for the same system. NPI has that information and can give me help in negotiating the finer points of the contract to ensure that I get at least the same deal as the guy around the corner. You know, when I went into this deal with NPI, I thought that most of my spending savings would come from the biggest deals that I did with NPI. As it turns out, most of the savings comes from the smallest deals that I have. But many times the savings is a 5, 10, or 15% downward trend in the maintenance agreement. Now, whoever negotiates a maintenance agreement and gives you money back, I mean, that just doesn't happen and never happened here. It was always a 3% increase based on CPI or something like that. And when NPI got involved, we've actually driven down our cost of maintenance an average of 5% a year. But you build it into your project management process. So the risk is zero for the organization. Now, that's hard to believe, a risk of zero to an organization for such a service, and I also didn't believe that. There's still a lot after 20 years that I don't know about contract negotiation. NPI is privy to information that I could never have. And because I don't have that kind of inside benchmarking data, I can't make the best deal possible in every instance for the hospital. And so today, we factor in, actually, NPI as a cut to our budget before we start a budget year. That if you don't know what others are paying for the same services that you're buying, then how can you be sure that you're getting a good deal? What NPI brings to that game is information. And just like IT is an information business for healthcare, NPI is an information business for IT. And that they give us the ammunition and the information necessary to drive down costs. That's a win-win situation in my estimation. NPI is just a partner of Denver Health that we leverage to control IT spend. As a tool, it provides a great deal of benefit to myself, improving my skills, but also a great deal of benefit to Denver Health as a whole.